Hi guys, I'm Dr. Andrew Iraniha, and today I'd like to discuss with you about a lifetime transformation available for patients with abdominal wall hernias. You see, when it comes into hernia repair, most surgeons focus on repairing the hernia and address the functional and anatomical abnormality. And in majority of cases, there's a very little attention to the aesthetic outcomes. So here I'm going to discuss the option of using tummy tuck procedure for repairing the abdominal wall hernia, not only to address the anatomical hernia defect, but also improve the final aesthetic results. Abdominal wall hernia occur when there is a weakness or defect in the abdominal wall muscle, leading to a protrusion of intra-abdominal structures. Patients with hernia can present with on and off abdominal pain and discomfort, especially during heavy activity, lifting, and straining. Hernia also can have potential of life-threatening complication, including incarceration or strangulation. Obviously, there are many different techniques to repair the abdominal wall hernia, but almost all of those procedures only address the underlying hernia defect with little attention to cosmetic results. The good news is that tummy tuck surgery offers a comprehensive approach to tackle both the hernia and the excess skin and fat. By combining hernia repair with aesthetic contouring, this procedure provides transformative results with lasting benefits and perhaps eliminating the need for placement of a mesh in some cases. Tummy tuck surgery is done through an incision in the lower abdomen to hide the scar tissue, and subsequently the skin is separated off the muscle all the way to the rib cage, which allows the surgeon to have freedom of repairing the abdominal wall hernia and tightening the muscle laxity for much better post-operative cosmetic appearance. This allows the surgeon to reinforce the hernia repair by tucking the fascia on top of each other and therefore reduce the risk of hernia recurrence in the future and eliminating the need for placement of any mesh implant. At the end, excess skin is excised and a new umbilicus is recreated. It's important to remember that each case is unique, and a personalized evaluation by a qualified professional is essential to determine if tummy tuck surgery is the right option for this patient. Consulting with an experienced surgeon who's familiar with all the possible techniques ensure a tailored approach and successful outcome. At Surgical Oasis Institute, I have expertise on all available cosmetic abdominal procedures as well as latest surgical techniques for all hernia repair. And my dedicated team and I are committed to providing safe and effective solution for patients with abdominal wall hernia. We prioritize your well-being and are here to guide you throughout your transformational journey. If you are interested to schedule a consultation, please contact my office at 949-646-8444. Thank you.